number 57, and I'll be presenting on the topic of nematodes on the behalf of roll number 56 to 60. What are nematodes? Commonly known as roundworms, they are a group of worms making up the phylum Nematoda. They can exist as free-living organisms in terrestrial aquatic environments, or they can be the parasites of both plants and animals. The classification of nematodes. On the basis of the human body part they affect, they can be classified into intestinal nematodes, including Ascaris lumbricoides and Cyclostoma duodenale, and Strongyloids stercoralis. Nematodes of large intestine, including Trichuris trichuria and Enterobius vermicularis, and the orally infecting intestinal nematodes, including Ascaris, Trichuris trichuria, and Enterobius vermicularis. Then we'll discuss some of the special features of the nematodes, including Enterobius, which cause infection only in the humans, and they have no animal reservoir. At the night, the female migrates from anus, lays thousands of eggs on the perianal skin. After 6 weeks, they develop into their embryonated form and they become infectious. Trichuris trichuria. Now, their eggs are hatching in the small intestine, then the larvae become immature adults. They migrate to colon, and they mature, mate, produce thousands of eggs, and the adult worm is whip-like in the colon. Ascaris lumbricoids. They are the largest intestinal nematodes, due to which they are also known as the giant roundworms. Cyclostoma duodenale. Humans are infected when flariform larvae is in moist soil, it penetrates the skin. Strongyloids stercoralis. 2 distinct life cycles are there, one taking place in the human body and other taking place in the soil when they are free living. And Strongyloids stercoralis can also cause autoinfection. Then the modes of transmission by the nematodes to spread infection include, for Enterobius, Trichuris, and Ascaris is by the ingestion of the eggs from the contaminated soil. And Cyclostoma indicator, the larvae penetrate the skin. Strongyloids, transmission is by the penetration of skin by larvae and also by autoinfection. Epidemiological determinants of the nematodes, starting with hookworm. Agent factors. High egg production ensures constant exposure to infection. Reservoir is obviously the humans, as we have discussed before, with no animal reservoir. Infective material is contaminated soil and the fecal material. Period of infectivity will be for as long as the parasite it remains in the human body, and transmission is by ingestion of eggs. Then we have host factors. All ages and all sexes are equally susceptible, and the highest incidence is found in the age group from 15 to 25 years. Malnourished people are more prone to getting infected. Host-parasite balance. Occupation, the people working in agricultural fields are more prone to infection than those working elsewhere. Then we have environmental factors. Dry soil is less favorable and sandy soil is more favorable for them. Temperature. A temperature of 25 to 30 is most favorable for them, and a temperature greater than 45 to 50 is going to kill the larvae, and a temperature of less than 13 will prevent the eggs from maturing. Also, oxygen, moisture, a rainfall of 40 millimeter, not flooding, all these they are favorable conditions. Sunlight is going to kill the larvae directly, but the shades are favorable for them. Human habits like walking barefoot and using the same places for defecation, and children playing in the contaminated soil without any footwear. So all these habits, they're going to make the person more prone to getting infected. Then we have Ascaris lumbricoids. Epidemiological factors of Ascaris include agent factors, egg production, maturation. Both, if there are more, there will be a greater chance of infection. Reservoir, only humans. Infective material, contaminated soil, and the fecal material. Host, age, all age groups equally affected. Malnourished individuals are more prone to infection. Environment, temperature, moisture, oxygen, radiation, same as we discussed for hookworm. Then human habits, periods of communicability and transmission, all these things are the same as we have discussed for hookworm. Whipworm. Agent factors include egg production and cold temperature resistance. Now, for hookworm and Ascaris, we discussed that the eggs are killed and they fail to mature below 13 degrees Celsius. But in the cases of whipworm, the eggs are much more resistant to lower temperatures. Infective material being the contaminated soil, and the fecal material reservoir are only human beings, and transmission is by the ingestion of eggs. Now we're going to briefly discuss the life cycle of Ascaris and strongyloids, starting off with Ascaris. In the diagram, it is shown that the eggs are present in the feces. Then after defecation, they are going to contaminate the soil. Now, if that soil is ingested, then certain eggs, they can be fertile and they are non-fertile. If the fertile egg is ingested, then it reaches the embryonated egg with the second stage larva, which is the infective stage. Then after ingested, it is going to be swallowed and goes into the intestine. From there, it enters into the bloodstream. Then it goes to the lungs, the trachea, the pharynx. Again, it is swallowed. It goes to the small intestine and develops into the adult worms. Now, these adult worms are going to lay the eggs, which are going to pass out in the feces, again contaminate the soil, and further the cycle goes on. Then we have the life cycle of strongyloid. We discussed that they have two distinct life cycles, one in the human body, which is the asexual parasitic life cycle, and the other in the soil, which is the free living sexual cycle. Now if we see the sexual cycle, we can see that rhabdiform larvae, they are converting into free living adults which lay the eggs in the soil. Then again they transform into the larvae and then the fleriform larvae. Now this is basically the sexual cycle. Now if these larvae, they penetrate their eggs, they are going to penetrate the skin, they enter into circulation, and then the human body cycle starts. They go into the heart, the lungs, the trachea, the pharynx. They are swallowed, entered into the small intestine, mainly the female worms, and then they lay the eggs in the mucosa, and again the rhabditiform larvae develops and the cycle goes on. And we discussed that strongyloids have a special feature that they can cause autoinfection. Autoinfection means that the rhabditiform larva is converted into the stage 3 larvae, and it can cause autoinfection by penetrating via the large intestine or the perianal skin. So it penetrates there, enters into circulation, and this process is known as autoinfection. So this was the life cycle. After that, we have the pathogenesis and the epidemiology. Enterobius. Pathology. Perianal pruritus is the most prominent symptom. Pruritus is an allergic reaction to the proteins of either the adult female or the eggs. So it's an allergic reaction due to which we have perianal pruritus. And if we scratch the area, then it can predispose to secondary bacterial infections. Epidemiology. It occurs worldwide, but most common ailment in United States. Children younger than 12 years are the most commonly affected group. Then we have Ascaris. The major damage, it occurs not due to the presence of adult worm in the intestine, but because of the migration. It migrates. The principal sites of tissue reaction are lungs. It causes inflammation there, and an eosinophilic exudate occurs, which is in response to the larval antigens. Because the adults, they derive the nourishment from ingested food. Now the food we're taking in, the Ascaris is feeding on that food, and because it is feeding on that food, so particularly if someone has a heavy worm burden, then what happens, it can lead to malnutrition, and this is especially true for children in developing countries. Then we have epidemiology. It's a very common infection, particularly in the tropics, because moisture favors their growth. Hundreds of millions of people are infected in the United States. Most cases occur in southern states. Then we have Encyclostoma indicator. Pathology. The major damage is due to loss of blood. Now what happens, the site at where the worm is attaching in the small intestine, there is going to be blood loss, and the worm and this blood is also being consumed by the worm, and it is oozing out from the site in response to an anticoagulant which the worm makes. Now because of this, blood is being lost, and it can cause microcytic anemia, and microcytic anemia occurs, then weakness and pallor will be seen, and up to 0.1 to 0.3 milliliter of worm are lost per day in the feces. Then epidemiology. It is also found worldwide, particularly in tropical areas. In United States, Necator is endemic in rural southern states. Walking barefooted on soil predisposes to infection. An important public health measure was requiring children to wear shoes to school. So if we wear footwear, so there will be less chances of direct contact with the contaminated soil, and the chances of infection by Encyclostoma indicator, even other nematodes, is going to be decreased. Then we have strongyloid stercoralis. Pathology. Most patients are asymptomatic, particularly those that have a low worm burden. Adult females in the wall of the adult females in the wall of the small intestine, they can cause inflammation resulting in watery diarrhea. Okay, so they are causing watery diarrhea. Larvae in the lungs, they can produce pneumonitis similar to the one caused by Ascaris. So they can also cause pneumonitis, which was being caused by Ascaris as well. Pruritus, ground issues occurring at the site of the larval penetration of the skin, as with the hookworm. So like hookworm, they are causing pruritus. Strongyloids stercoralis also causes cutaneous larva migrans. Then epidemiology. Strongyloids occurs primarily in tropics, particularly in Southeast Asia, and the geographic pattern is similar to hookworm because the same type of soil is required, and in the United States it's an endemic in the southeastern states. Then we have trichuris. Although adult trichuris, they burrow their hair like interior ends into the intestinal mucosa, they do not cause significant anemia. Okay, so over here they are not causing any blood loss or anemia. Trichuris may cause diarrhea, but most infections are asymptomatic. So over here, most of the infections are asymptomatic. Epidemiology. It occurs worldwide, particularly in the tropics. More than 500 million people are affected. In the United States, it occurs mainly in the southern states. Okay, now we're going to discuss the diseases and the clinical features of the nematodes. Enterobius. It causes pinworm infection, enterobiasis, and the clinical features include perianal pruritus. Trichuris. It causes whipworm infection, trichuriasis, and also it can cause appendicitis as well because of the mechanical obstruction of the appendix due to the worm burden. Clinical features include epigastric pain, nausea, vomiting, and it can also be severe, including anemia and rectal prolapse. Encyclostoma indicator causes hookworm infection and dermal lesions, volvulus, intestinal obstruction, bowel perforation in the ileocecal region. Clinical features include iron deficiency anemia, retarded physical growth in children, and they also can cause a decreased ability of sustained hard work in the adults and hypoalbuminemia. And the disease has an effect of community in three major areas: nutrition, growth, development, work productivity, and medical care cost. Ascaris is causing ascariosis. Clinical features include most infections are asymptomatic, but it can cause pneumonia if it goes into the lungs, which presents with fever, cough, and eosinophilia. Intestinal manifestations include diarrhea, abdominal pain, and general malaise. Finally, we are going to discuss the prevention and control. Prevention and control, we have primary and secondary methods. In the primary methods include sanitary disposal of human excreta and having proper sewage disposal systems, provision of safe drinking water and good food hygiene habits, health education of the community in the use of sanitary latrines and personal hygiene, changing behavioral patterns, and measures of personal protection including the wearing of proper footwear, washing hands, washing the fruits and vegetables that are grown in the soil, and so on. Now we have secondary methods. Now the primary methods were aimed at preventing the transmission, and the secondary methods, they are aimed at the treatment of human reservoirs. So we are treating them. If we treat it, then the chances of infection to other human beings is going to be reduced. So we use different drugs including albendazole, mebendazole, levomazole, and pyrantel. Albendazole dose is for children above 2 years is 400 mg and is contraindicated in children below 2 years. Mebendazole, the usual dose is 100 mg twice daily for all ages above 2 years. Levomazole, a single oral dose of 2.5 mg per kg body weight and a maximum 150 mg has been recommended. Levomazole is considered to be a drug of choice for many cases and is used successfully in the mass treatment of ascariasis with usually no side effects. Pyrantel is effective in a single dose of 10 mg per kg body weight and a maximum dose of 1 gram is recommended. Okay, treatment of anemia and other complications. Anemia can be treated with iron and folic acid supplements, and other complications which the patient has to be treated for include hyperproteinemia and hypereosinophilia. Then we have preventive chemotherapy. Now over here, WHO has a strategy for controlling the soil transmitted helminth infection. Now what it does is basically it aims at controlling the morbidity by periodically treating the people that are living in endemic areas and are at a high risk. Now the high risk people include the preschool age children, the school age children, women of childbearing age including the pregnant women of second and third trimester, and adults in certain high risk occupations like tea pickers or miners. Now periodic deworming of the at risk at-risk people without any previous individual diagnosis, and we can decrease the morbidity by reducing the worm burden. Now, in order to reduce the worm burden, we can give the treatment once a year if the prevalence is 50%, and twice a year if the prevalence is over 20%. Okay. And the recommended drugs, they include albendazole 400 milligram and mebendazole 500 milligram. Now, for the preventive chemotherapy, we can do at the school age children. It can be done through child health days or supplementation programs. For school age children, it can be integrated with the school health programs. Because schools, they provide an easy provision of health hygiene education component like promotion of hand washing and improved sanitation. So there are different methods of preventing the morbidity by periodic treatment of at-risk people in endemic areas. In the end, the global target is to eliminate the morbidity in children due to soil-transmitted helminthiasis by the year 2020, which will be achieved by regularly treating at least 75% children in endemic areas, an estimated of 873 million children. With this, we end our presentation. Thank you so much.